winning this award, sir, what do you think has led to this recognition?
I believe that appreciation and recognition of good work is as important as good work itself. I am an expert in robotic surgeries for GI disorders and hernia abdomen wall reconstruction, and I am in a different part of the country here. However, business world did their homework. They identified talents across the country, and they realized that honing them, nurturing them is good enough to ensure that the next generation of surgeons is prepared, they are empowered, and they decided to appreciate us. So yes, I feel very honored, I feel humbled, and here I am.
So, how do you think you work, since you work in the field of robotic surgeries, how do you think that space evolving in India at this point in time?
Minimal invasive surgery, also called as the laparoscopic surgery as we understand, is now about three and a half decades old technology. There has been a gradual evolution in the way laparoscopic surgery is now performed as opposed to say in early 1990s. There were some limitations, there were some shortfalls in it. Robotic platform was an assimilation of all the solutions that laparoscopic surgery platform needed, and it was just packed into one common platform, and the surgeon got to do surgeries in the best possible way. So I see robotic surgery essentially not only as an evolution but as a revolution in minimal invasive surgery.
Absolutely. So when you look at the price factor or the cost of a robotic surgery vis-a-vis surgery which is not robotic, let's say laparoscopy or the other options that we have, the cost difference is huge. And where do you think the value addition is the difference here, or what do you reckon about the price factor?
Yeah, very well raised point. So I do often get asked this question on a lot of platforms by patients families, and even doctors, surgeons for that matter. We are right now so much focused on the cost that we do not focus on the precision part. See, you need to understand that precision and perfection, especially the one that can be reproducible across the globe, will come at a cost. Traditionally, we do see that technology doesn't ever get cheaper. Technology will always keep on getting escalation in the form of newer technology, which will then become more costlier. The older technology, which tends to get cheaper, is actually of no use now. So just think of the cell phones which existed about 2 decades back. They're dirt cheap right now, but would you want them right now? The answer is no. So technology, advanced technology and adoption of same comes at a price point. We are paying the price for precision and perfection, and I believe that what can be the cost of a life, or what can be cost of a predictably good surgery each and every time? Answer is let the patient decide. So if the patient can afford that kind of health care, the patient can afford that kind of surgery, I believe the patient should get that kind of surgery.
Right. Going forward, looking at the penetration at this point in time, even Da Vinci recently said they've only sold 100 of their robots. Maybe the number is now increased. But when you see the penetration, and you talked about since long back it is there, the technology is there.
Yes.
Where do you see its future in India?
Yes. So as I gave an insight that laparoscopic surgery is now about 3.5 decades old, let me tell you, robotic surgery is now a 2-decade-old technology. Yes, it has evolved into something amazing of what we get to operate on right now, but there has been evolution in that as well. Da Vinci, it is by the Intuitive Surgical, is one of the most widely used platform across the globe, and I have been working on the same since years now, and I have my full faith and trust in the same. It has kind of given the best possible tool that a surgeon would need to do surgeries in the most complicated cases to the most simplest case, where you understand that even if 1 or 2% of complications can be decreased over say 1 million patients, it translates into a huge number of beneficial outcomes, and that is what robotic surgery is going to achieve. The good part, you understand that the technology is so good that there are multiple companies which are coming up with their own versions of the robots. So at least in India as of now, I see Hugo by Medtronic, we have Mantra by SSI, and we have a robot by CMR as well, the Versius. So the space is getting penetrated by multiple players in an effort to give surgeons that kind of a tool which empowers them to do what they wish to. So in the years to come, we will see either intelligent laparoscopic instruments, or we'll see more of these robotic companies with varied kind of platforms, maybe even tailor-made. So some very specific platform for specific surgeries. So that seems to be the future in the years to come.
Absolutely. Thank you so much for joining us here.
Thank you. Thank you for having me.